Hi, I'm Jeannie Faulkner, and you're joining me today for my new video podcast series where we're going to be talking about women's health, maternal health, pregnancy, parenting, and whatever's on your mind. I've been a registered nurse for 25 years. I write Fit Pregnancies as the Labor Nurse column. I co-wrote the Complete Illustrated Birthing Companion, and I've been writing about global maternal health issues for years. I'm currently working on my next book, Brass Tacks Pregnancy. Since I've been answering women's health questions online, in person, and in print for decades, I decided that now is the time to open up the conversation a little bit wider. So one of the things that I hear a lot from women as they're entering into prenatal care or getting well woman care is something like this. They'll say, my doctor told me I might be at increased risk for this condition, so I have to get all these extra tests just in case. Well, that's scary information for a lot of women. But here's the thing. If you dig a little deeper into what your doctor is actually saying, you're going to learn a lot about how the healthcare industry works. So let's look at this a little bit more closely. My doctor told me I might be at increased risk for this condition, so I have to get all these extra tests just in case. Did your doctor say you were at increased risk? No, you might be. Chances are very good that you might not be. What does increased risk mean? It means your chances are higher. It doesn't mean you're going to get sick or get that condition. It means that when you look at all the people in a particular study, some who have some of your characteristics have developed this condition. It's kind of like saying you might develop this condition because some people who are like you or in your family or in your age group have this. Chances are also very good that you will not get this condition. Next part of that statement was, therefore I have to get all these extra tests. No, you don't. You don't have to do anything medically that you don't want to do. In fact, any test or procedure that you get is entirely your choice. If you get your blood drawn, it's only because you chose to have your blood drawn. Your doctor will recommend certain tests and procedures because she thinks they're valuable, either to rule out or diagnose a condition or to treat it, or to cover her ass for documentation purposes. But don't hand your healthcare decision-making power over to someone else. You're driving your health. Your doctor is just along for the ride and giving you directions. So what about those extra tests? Well, maybe you need them and maybe you don't. A lot of doctors order a full menu of tests for all their patients when a more a la carte approach would be more appropriate. Ask your doctor what value they'll provide your pregnancy or your health. Is the information you receive from this test going to make you healthier or make your pregnancy safer? If the answer is yes, your health and healthcare will change if we know this information, well then have the test. If the answer is, it probably won't change anything, but at least we'll know, then the next question is, why do we need to know? If you don't really need the information or it's not going to change anything about your health or healthcare, don't bother. Too often, one test leads to another and another until finally the only thing you have to show for all of it is the reassurance that you never really had anything in the first place. So how about that just in case part? I'm on the doctor's side here. Doctors are under intense stress. They carry tremendous financial burdens in terms of malpractice insurance, office overhead, student loan debt. They carry huge responsibilities for their patients, their families, their employees, and their colleagues. One serious mistake can be devastating. A patient could be injured or could die. Families can sue. And it's not usually because the doctor is stupid or negligent or a jerk. It's because shit happens. This is especially true in maternal health care. Doctors often order far more tests and procedures and interventions than are really necessary because they have to be sure they've covered everything. And they have to protect themselves from lawsuits just in case. Just in case that one patient has a fluke crisis, or just in case a situation goes wrong, or just in case there's a bad outcome. There's really no way to eliminate all the risks for all the mothers and all the women. Pregnancy is never a risk-free situation, and even with the best, most advanced healthcare, stuff happens. Usually it's nobody's fault. But because they can't afford to be blamed for not having done enough, many doctors will do more tests, interventions, and procedures to make sure everything's accounted for. The problem is, even in the high intervention climate we're delivering babies in now, doing more medicine has not added up to providing better medicine. And we're actually seeing increased rates of flu crises, bad outcomes, and maternal deaths and injuries. So, how do you know if you should have a test or procedure? Well, you start asking questions. You ask, what exactly is this test for? If it's a test you need because you're sick and this test is going to determine your course of treatment, well, by all means, you have the test. If you're not sick and the test is to determine your odds of whether you or your baby are going to get sick, think about why you need that information. Is there something specific you can do to prevent or avoid that sickness? Yes? Well, go for it. No? Why do you need to focus on the remote possibility of getting sick? What are the actual numbers associated with your increased risk? Now, if your doctor says you have twice the risk of having this condition because your grandmother had it, then ask, what number are you actually talking about? Let's say in the normal population, 0.1% of women have your grandmother's condition. That means twice that risk is 0.2%, which means 99.8% of women don't have it. It's sometimes helpful to think of things that way. Instead of thinking about having twice the risk of a certain condition, why not focus on the fact that better than 99% of women don't get it? You're probably in that percentage. What if your doctor says that twice the risk is actually a pretty significant number, though? Well, then maybe you want to know. Maybe it'll change the way you approach your health and your health care. So how does all of this translate into real healthcare situation? Well, let me tell you about a really common maternal health scenario that we see all the time. Let's say a first-time mother is approaching her due date, and she goes in to see her doctor, and her doctor says, I think you're running a risk of having a baby that's too big for you to deliver, so let's get you on over to the hospital, and we're going to do an induction. What the mother hears is, my baby is too big, so I have to be induced. That's not really what the doctor said. He actually said, you're running the risk, which means your baby might be too big, but then again, he might not be too big. It's pretty hard to tell exactly how large a baby is, even by ultrasound before he's born. It's even harder to tell how big a baby a mom can deliver until she's tried. Well, what's the harm of having the procedure anyways? What's the harm in having an induction? Well, we're seeing how this plays out time and time again, and we're not seeing good outcomes. If mom's body isn't really ready for labor and her baby isn't really ready to be born, the chances of her having a really positive birth outcome are not that great. Both probably need more time to prepare for birth, and the best labors start spontaneously. So when mom's induction doesn't progress well, she winds up in the operating room for a C-section. Too often, that's the point where we learn the baby wasn't really all that big in the first place. When she gets pregnant the next time, chances are she'll be signed up for another C-section because a lot of doctors and hospitals aren't doing vaginal births after cesarean anymore. So mom now has 2 surgeries she didn't need. All this because her baby might be too big. We see this all the time. Ask the questions. Keep asking. And when you're comfortable with the answers, then sign on for the test or the procedure, but know that you are making your own choices here. If you're not comfortable, say no thanks, knowing you're making that choice. You're driving this thing called your health, and it's important to know what direction your healthcare map is headed. So that's enough for today. Thanks a lot for being with me. Come back next week and we'll talk about some more. Bye-bye.